All right, gents, what do we have on the docket today?
We have Kevin Adley coming to us from Dr. Lullaby.
Dr. Lullaby.
Yeah, exciting stuff. These guys do behavioral therapy with insomnia patients. And of course, we know that's the biggest sleeping and waking disorder that our community has to tackle. So I'm excited to see what Kevin's going to talk about today.
Are we going to make him sing? Are we going to make him sing like we did Irene a couple weeks ago?
Yeah, I'm going to go with no on that. No.
Yeah, let's leave that to the professionals.
Yeah, absolutely.
Right.
We'll bring Irene back.
But I've always found CBT very interesting, especially when I had the chance to work with a university. So I'll be very curious to see what he has to say about that. I think it is something that is highly neglected in sleep medicine. Going around, when I had other jobs, going around the country talking to different clinicians and such, it's almost forgotten, I think. I don't know. What do y'all think about that?
Yeah, I know. And I think the other thing I think about too is for our listeners that are technologists, particularly the CCSH sleep coach, is, when they need to not go in that direction. It's easy to want to treat everyone. And I'd like to see what his thoughts on, what when the CCSH or sleep coach needs to pitch and not go down the road of trying to be the behavioral sleep medicine professional.
That's a good point. I mean, as a coach, what do? You point people in the right direction to get the most, right? And if somebody needs an additional, like for example, if I'm a coach and I need somebody to get therapy for their knee, I'm not going to try to do the thing myself. Right. I would send it to a therapist or a physician or whatever. And I think that's a fantastic point.
Well, I think the most important thing for today is that, Robert's joined the Facial Hair Club. So,
yeah,
yes.
Almost as pretty as we are, Jerry.
Although I did see Jerry lean over a little while ago, and he might be getting closer to me than he is you. Emerson on the top. I can only say that, Jerry, because we're far apart from each other. Because you've been working out, man. I saw you a few weeks back, and
he's looking buff, isn't he?
He is.
Well, thanks. Yeah, that's all. Like we were talking to Kevin earlier. That's all editing. So it's post production.
There you go.
Hey, let's talk to Kevin. By the way.
What's that?
I said let's talk to Kevin. By the way.
Let's do it.
All right.
Yep.
So, folks, hold on, and as we get ready for this show.
Like that.
Welcome, everyone, once again to another fantastic episode of SleepTech Talk, the sleep podcast with your hosts and friends, Emerson Kerr, Robert Miller, and me, Dr. Gerald George Moneycarot. With that, Emerson, tell us what's going on today.
All right. Well, I'm not as attractive as Robert is, but thank you. We've got a great guest with us today. We have Kevin Adley, hails from Chicago. He is the Director of Business Development with Dr. Lullaby. Kevin is a registered polysomnographic technologist and has a CCSH credential as well. Over 20 years of experience in the field of sleep medicine. He's worked in a variety of areas and has developed an expertise in offering alternative strategies to both providers and patients for traditional sleep treatments. He currently serves as vice chair for the AAST's Educational Advisory Committee, thank you, and is on the board of directors for the Illinois Sleep Society. He is committed to giving back to the field and enjoys being a part of the innovation process in the field of sleep medicine. Kevin, welcome to the SleepTech Talk podcast. You've listened to the podcast. We appreciate you being a part of our journey and seeing our evolution. But one of the things that we like to hear is yours. We certainly want to hear all about Dr. Lullaby, but we are always super interested in how you got here because, as you know, the three of us didn't plan this. we kind of landed in this backwards. And I know that you've had quite the career. When you and I met, you were a part of Midwest Dental and then moved on from that. But how did you get into sleep? How'd you get here, Kevin?
Thank you, Emerson, and thank you, gentlemen. So first and foremost, I want to again thank you. It's an honor being on this. Like you said, I have been on this journey with you guys since day one, and it's been great to see kind of the development of the podcast. So keep up the great work there. And like many of the other guests that have been on here, yeah, I did. I accidentally fell into sleep in 2001. The dad of one of my best friends growing up was he had opened up some sleep centers in Northwest Indiana, and he was looking for overnight techs, and he was training and hiring. So at the time, I was in school. I was studying bio pre-med, and this seemed to me to be a great opportunity. Number one, to get that that medical experience in the medical field, but then also good lifestyle fit. So I jumped into it and enjoyed it. And I can recall that initially, not too many people understood what I did. And I think that over the last 20 years, the industry has done a great job at educating the public at what sleep medicine is. And then in 2003, I ended up taking a job at the University of Chicago and spent the next 15 years there. And the way I look at my time at the University of Chicago is really in two parts. The first 5 years, I had one foot out the door the entire time in the field. I was waiting for the next thing to happen, and I was going to move on from sleep. And through that time, well, in around 2009, I kind of hit an emotional bottom, if you will. And I came to several epiphanies at that time, and one of them was gratitude. And it's kind of fitting we're doing this on the week of Thanksgiving because, being thankful, being grateful has been really a daily part of my life since then. And what it allowed me to do is this kind of change or metanoia in perspective. It made me grateful for, the experiences of the past, made me grateful for my position at the present and future opportunities. And really, for the first time, I really started taking sleep technology as a career. And from then, shortly after that, I ended up getting advanced into the chief sleep technologist role. And what an experience that was. It was fantastic. I was working alongside the best minds in sleep medicine. And that was my school. I mean, it was such a fantastic experience. I learned so much there between the clinical and the research that we were doing. And it was just a great, fabulous experience. And in like 2014-ish, I started really working more and taking an active participation within clinic for the sleep physicians. And, it was there where I kind of started exploring that CCSH. I think that was when it initially had came out. And I was one of the first, part of that first cohort that took the test for the CCSH credential and really, embraced that new opportunity of kind of, again, this chief tech roles were still there, but also that clinical experience of being that physician extender in clinic and really kind of, just, I think at that time I saw that, it was sleep was changing and the role of the technologist. There was, I guess a new branch to go into, and I was really, really enjoying it. And in about 2018, I realized that, it kind of hit me where, I kind of got the itch to go and try something new, like, go beyond the walls of the sleep lab. And it was at that time that I took the clinical director position for Midwest Dental Sleep Center, who is the nation's largest provider in dental sleep medicine. And let me tell you, a fantastic company to work for, and they do dental sleep medicine the right way. And it truly was one of those experiences where, you don't know what you don't know until you get in there. And I spent the next 4 years learning every day. And it was, again, a great experience to kind of set me up to where I'm at today with Dr. Lullaby.
Hey, Kevin, why don't you tell us a little bit about what you do with Dr. Lullaby? I love the service, and I know you and I have talked trying to figure out ways to work together. But tell us what you do at Dr. Lullaby, maybe even a little bit about the company and what you offer. I know it's certainly a unique space and a much needed space in sleep medicine, and we'd love to know what what specifically you're doing to help the company grow.
Yeah, so I'm the director of business development, and so really my role is bringing in business, right? And it's really reaching out, finding avenues where our services are needed. We've really kind of went full steam ahead with the mission of our overall mission is to open up access to care for behavioral sleep medicine services. And who better to go to than the provider? They're the ones who are in need. Their clinics are, bogged down times with insomnia. They don't have anybody to send their insomnia patients to for, the first line treatment recommendation for treating chronic insomnia, which is CBTI. And, so I'm really building and growing awareness of the company and, looking to, get that word out to the physicians, the sleep centers across the country. Right now, we're in 6 states: Wisconsin, Illinois, Indiana, Ohio, Georgia, and Florida. And so we're really trying to look at density for those specific states. But the goal is to grow nationally and to, get into all 50 states. And actually, our goal is to become global, which we're one step away from. We're shortly away from that goal. We're actually in 2023 going to be doing a partnership with ResMed and in Australia, which is going to be kind of a pilot program that we're launching, which we're super excited about. And so, again, outside of the kind of the physician landscape, working with the industry and trying to find kind of that need and that fit for companies like ResMed, Inspire, DMEs, and other services that definitely have some sort of patient reach that could be useful. Our services could be useful for them.
Go ahead, Emerson. Looks like you're trying to get the unmute button.
Yeah, no, I was just thinking more kind of going back to the clinical side of it. COMISA has been a hot topic for a little while because of, as we struggle to find tools for adherence for CPAP. The numbers are epically bad when you look at, anywhere from 1 to 2 to 3 years out on adherence with them. So when you look at some of the strategies you use and working with your patients, what are some of the really highlights that Dr. Lullaby brings to our friends in sleep technology? Because most of the folks listening to us are wondering, okay, how does this fit into what I do, as a sleep tech? What are some of the things that you can enhance their practice with, strategies that you guys bring to really treat this unique type of patient, this COMISA patient?
Mm-hmm. Yeah, so the mission, again, going back to the mission of Dr. Lullaby, opening up access to care. So there's less than 200 board certified providers out there in the country. And, according to the American Academy of Sleep Medicine, CBTI is the first treatment option for treating insomnia, right? So oftentimes patients, what ends up happening is patients end up on sleeping medication prior to, ever any attempt because of the access to care. COMISA is, like you said, the hot topic, and patients can experience, I think the second most common sleep disorder is OSA. So somebody with OSA can easily at some point develop insomnia. I think the way I see it fit for sleep labs, specifically sleep technologists, is being able to I guess have that education to identify these patients that kind of are in need of that first line recommendation. We have sleep labs that have our brochures in their lab for their patients. Those patients that have a proclivity for insomnia, or oftentimes insomnia patients, that's kind of a rule out for in overnight study. However, one of the services that we do offer is therapy acclimation. So, that goes beyond the, say, issues that a patient may have with equipment. This is specifically more the patients that are struggling with the behavioral and the cognitive component to it. And we can help. We've been receiving, referrals for CPAP adherence patients that are struggling to adhere to CPAP, also that develop insomnia, while on CPAP. And then also, patients that are on Inspire therapy, that's, there's the pre-implant, those patients who have insomnia, they're actually an exclusion from Inspire therapy. We can help address that. And then, the Inspire therapy itself, a lot of the things that come up is there, the acclimation to that can be challenging, specifically with kind of the anticipation anxiety for, the device being triggered. So all of our providers are all PhD psychologist level providers, and they're all specifically trained in behavioral sleep medicine. So, that whole gamut of disorders, anything from, straight insomnia to CPAP adherence struggles to nightmare disorders, anything that kind of fits under that umbrella of behavioral sleep medicine is, our providers are very well trained with that.
It's interesting you say that, because we just several of us were a part of the Society of Behavioral Sleep Medicine conference, and during our CCSH portion of it, we were really focusing on the CCSH really staying in their lane, because I think sometimes as clinicians, because we know how to do desensitization, it doesn't necessarily mean that we know how to navigate some of the challenges from a behavior standpoint that a trained psychologist really needs to be the one involved in that. In your experience, what are some of the things that the CCSH or sleep technologists that might be involved in some of those things, when are some of those moments where they need to be thinking, what, this is really stepping out of my lane, and I really need to look to Dr. Lullaby or a trained psychologist to really step into this space? What would be some of your advice to help them recognize those moments?
Yeah, that's a great question. And I think that there is a challenge there, because oftentimes, as a CCSH or sleep coach, you may know those answers, but it comes down to, like, when do you start practicing medicine, right? And when are you starting to give medical advice to this patient? I think specifically a concern that kind of comes to mind is, big component for CBTI is sleep restriction, right? So you're giving the patient a set bedtime, and what you're trying to do is you're trying to increase that sleep pressure through the day, so that when it is time for them to go to bed, they're able to go to bed, and it's easier for them to go to bed. The challenges with navigating through kind of that sleep restriction phase is, it can be painful for the patient. And if, you always run the risk of something happening to the patient, like a car accident, if they fall asleep, because they're struggling through this sleep restriction phase. So I would say that definitely, as a, our, PhD or a sleep psychologist, they have a license. They're a licensed provider in which they can, make those types of recommendations, is, just a good example.
Any interesting case studies that you'd be willing, or that you can talk about on the show, just because, just like all of us, we've been in these situations where we were at clinic and there was always something interesting that popped up. So I'm just curious if there was something that you could talk about or talk to.
You knew I was going to ask that, by the way, Jerry.
I wish I would have known you were going to ask that, because I love case studies, and I think they're one of the best ways to learn. And I could have pulled one and like been prepared for that question. However, since I'm really my kind of part is outside of the clinical scope and facing with a patient, I can't really speak to many specific case, like a specific case. What I can say though is that we are some of the really neat kind of initiatives that we're doing is like the Inspire work. So we're kind of exploring this partnership with Inspire, and that's looking at the pre-implant. So again, going and treating those patients that have insomnia or proclivity for insomnia before implementation, and then the post-implementation patients who are struggling to adherence. But then oftentimes we look at this COMISA, right, of somebody who's treated on their therapy, they're great with CPAP or they're great with Inspire, but all of a sudden they develop insomnia. Now, we can be a part of that picture where we can get that patient sleeping better, and hopefully, say somebody, companies like ResMed, where they're looking at tracking data, adherence data through the course of the patient's use of a device, or Inspire. I know Inspire is kind of focusing in on long-term adherence. We can help bolster those numbers up and improve outcomes. So I would say that's kind of my unprepared answer, if you will.
Well, I appreciate that, and it's always curious. All of us are clinicians at heart, so we're always curious about that sort of thing. At the same time, as much as want to ask you more questions, we are running out of time. Do you have anything that you want to add really briefly before we close?
Yeah, no, I guess speaking to the audience, the SleepTechs, I look at that really three parts for the text, that the three different audiences I'm talking to. We're here to be, I really love the collaborative approach to medicine, right? And multidiscipline approach. And so if you're not, familiarize yourself with the BSM literature. Most people don't realize that CBTI is the first line treatment recommendation for treating chronic insomnia. And, just sharing that information, you can help your patients as an overnight tech. You can also help your patients as that CCSH physician extender. And then, also for those that are out there doing the sleep coaching, being informed of all the literature is really important to be able to have and best help your patients.
Thank you so much, Kevin. I appreciate that. And folks, we are out of time. So we just want to say thank you so much for joining us once again. We sincerely appreciate you. Do not forget to hit the like button. Don't forget to subscribe. And most importantly, do not forget to share this with all the other thousands and thousands of sleep techs that are out there, or anybody that's interested in sleep, period. There are thousands. I know the registry numbers, so don't think you can hide from us. Be sure to subscribe and listen to it. And those of you who are on YouTube, we thank you so much. The audience is growing little by little, and we sincerely appreciate that. And thanks again to our sponsor, React Health. Kevin, thank you so much for joining us. With that, we close, and until next time, lights on. So guys, what'd you think?
Sounds like a great program. Loved hearing how they're really tackling both insomnia and COMISA. COMISA is a really fascinating problem, in particular because of the non-adherence challenges patients have with CPAP, and right. Having that solution is big. So I'm glad we have a source for our listeners to lean on, for those types of patients.
I agree.
And it's also digital, which I think is a big differentiator than, trying to find a local provider, which in some cases there's just no one available in many areas to be able to provide that. So I think they have a great solution. And I know we talked to Kevin today, but if you actually get to speak to the CEO of the company, she's fantastic too. I've had an opportunity to meet her in person, and she's awesome as well.
What's her name?
It's been a while.
Okay, well, that's fine. But I think the insight that you just gave there is that the fact that there are not enough of providers out there. I was a little surprised when he said that there were only 200 in the nation, and I was like, holy crap. I do recall there was a time in Texas, as large as it is, we only had 2 providers
Wow.
that were board certified PhDs, and you're like, holy crap, how are they going to, that too, for CBT, how are they going to manage all these patients? And I agree, it's something that's really needed.
It's Dr. Adley, by the way. It just took me a few minutes. It took me a second to pull
There
it
you go.
out of my.
There you go. I think the other thing that's important, and I was so glad that Kevin went this way, is that there's this surge of sleep coaching. And it's so exciting to see, our colleagues finding this place. But, when you get out, this sounded like you mentioned in our pre-cals, is that, all because your client has an injured knee doesn't mean that you need to be doing scoping and surgery.
Right.
When it gets to CBTI and sleep restriction and all the things that are really part of behaviorist job, they have a license and they're operating under the safety of that license. And so our sleep coaching friends need to take a pause whenever they're thinking of venturing into the space of CBTI and some of these things, because they're not licensed to do it. And that puts them at great risk. And that is not something that any of us want for our colleagues and friends that are being the pioneers in this new space. So I was so glad that Kevin brought that up.
Good point. Excellent point.
Hey, by the way, are we ever going to have a guest who didn't stumble into sleep? They purposefully meant to join our field.
Yeah, we're going to find that.
Amazing.
Yeah.
Yeah.
Hey, good point. Folks out there that are watching and listening, I think that's a challenge to y'all. If any of you, or if you know of anyone that said, hey, when I grow up, I want to be a sleep professional, let us know. We might just have you on the show.
There you go.
That's right.
All right. Anything else, guys?
No. It's a
Good
good show.
this week.
Yep.
What'd you say?
I said that's it for this week.
That's it for this week. Okay. And I guess that's all we have. And looking forward to our next show. I think we have some really interesting guests in line, and we're excited to share it with you folks. So until next time, cheers. Thank you all, and see you on the next show.